Okay, so we're on to the alarm point breathing. And we're just going to start off with a gentle focus on the abdomen. So as you're breathing in, you feel the abdomen rise. And as you breathe out, you feel the abdomen fall. And as you take that in-breath, you're watching and feeling the whole of the in-breath, and then observing and feeling the whole of the out-breath. Bring your awareness now into the first alarm point, the bladder point, on the pubic bone. And get a sense of, as you take your next in-breath, between the pubic bone and the coccyx, there's a sense of expansion. And as you breathe out, a sense of letting go. And on that next in-breath at the bladder point, you're going to breathe sideways as well as up and down. So in towards the hips as well. And as you breathe out fully. Moving on to the next point, which is the small intestines. So sort of halfway between the umbilicus and the pubic bone. And as you take that next in-breath, feel that point rising and engaging with the low back. Breathing in, that space, that balloon fills. Breathing out, that area softens and relaxes and lets go. The next point is the triple heater, about an inch below the belly button. And again, as you breathe in, feel that point rise. And as you breathe out, feel that point fall. All the way out. The next point is the stomach, and that's around about 3 inches below the xiphisternum. So just focusing your next in-breath at that point. So you're breathing in between the stomach point and down to around about T10. On the next in-breath, the focus is at the tip of the xiphisternum. This is the heart alarm point. Again, get that sense of breathing in. The point moves up towards the ceiling, the spine moves towards the floor. And then having a sense of the space going laterally as well towards the sides of the chest as you breathe in, and then retreating back to the xiphisternum. The next central point is the pericardium, which is around about the middle of the chest bone, in line with the nipples. And again, get a sense of the chest bone rising as you breathe in, and around T4, moving down towards the floor. We're moving on now to the bilateral points, and starting with the kidney, which is the tip of the 12th rib. So on the next in-breath, just get a sense of breathing into both the right and left 12th rib area. And as you breathe out, invite that space to empty fully. The next in-breath is going to be around the tip of the 11th rib, so round to the sides of the torso. And again, as you breathe in, feel a sense now of the girth pushing out towards the sides as you breathe in. Then as you breathe out, the tip of the 12th rib coming back towards the spine. So the in-breath, the 11th rib moves away from the spine, the out-breath back towards the spine. The next in-breath is going to be the large intestines, which is either side of the tummy button, around about an inch either side, away from the tummy button. So as you breathe in, feel both spaces moving up towards the ceiling. The low back pushing against the floor, and as you breathe out, both spaces retreating back, softening and relaxing. The next in-breath is going to be the liver point. So in line with the nipples down towards the end of the ribs, so just before the ribs meet the abdomen. And as you breathe in, feel the chest rise and expand. And then as you breathe out, soften, relax and let go. The next in-breath is going to be at the gallbladder point, so we need to move our fingers towards the side of the chest, about an inch or so. And as you take the next in-breath, focus the breath on that point with the ribs moving away from the spine. And then as you breathe out, the ribs return back towards the spine, back to the middle. The next in-breath is going to be at the lung point, which is the coracoid process, which is the knobbly bit on your shoulders. And as you breathe in, get a sense of that bony bit coming up towards the ceiling, and then breathing out, the bony bit retreating back down towards the floor. So as you breathe out, the whole of the shoulder relaxes, softens back to the floor. Both arms and shoulders, legs relax now. And on the next in-breath, get a sense of the whole of the body filling, expanding, lengthening. As you breathe in, and then the whole of the body softening, relaxing, letting go as you breathe out. And for the next few moments, simply observe and watch the filling and emptying of the body with your breath. bringing your attention now back down to the toes, and just start those toes wiggling up to the knees and squeezing the backs of the knees down towards the floor. Okey cokey with your buttocks, your right buttock, your left buttock, pushing that low back, the middle back to the floor, and then your shoulders gently pushing against the floor, rolling the head from side to side, and when you feel ready, open those eyes and just bring your awareness back into the room.